Day 20 of 30. We are almost done with Block 4, Thyroid and Metabolism. Today we talk about something that scares a lot of people. A lump in your neck. You feel it when you swallow. You panic. Is it cancer? But here's the truth, thyroid nodules are incredibly common. And most of them are completely harmless. Let me ask you something. Have you ever felt a small bump in your neck while swallowing? Maybe you noticed it in the mirror. Or someone pointed it out. Your first thought is probably cancer. That's normal. But here's what you need to know, about 50% of people over the age of 50 have thyroid nodules. Half of everyone over 50. And the vast majority, more than 90%, are benign. Not cancer. Just harmless little lumps that sit there and do nothing. Here's the real problem. The fear of cancer makes people do two things. Either they panic and rush into unnecessary surgery. Or they ignore it completely and never get checked. Both are wrong. The right approach is simple: get an ultrasound. An ultrasound is painless and takes 15 minutes. It tells the doctor the size, shape, and texture of the nodule. If it looks suspicious, the next step is a biopsy. A thin needle takes a small sample. That's it. No panic needed. Just smart, calm action. Here are the numbers. Thyroid nodules are found in 50 to 60% of people over 50 when you look carefully with ultrasound. Only 5 to 15% of these nodules are cancerous. And even the ones that are cancerous, thyroid cancer has a 98% survival rate. It is one of the most treatable cancers. Most people with thyroid cancer live normal, full lives. The most common type, papillary thyroid cancer, grows very slowly and rarely spreads. So even in the worst case, the outlook is excellent. Your thyroid is like that old couch in your living room. You know the one. It's been there for years. You sit on it every day. One day, you lift a cushion and find coins, remote controls, a pen, some random junk. Nodules are exactly like that. Mostly harmless stuff that collects under the cushion. But every once in a while, you find something sharp, a needle or a thumbtack. That's the 5 to 15%. You don't throw away the whole couch because of one thumbtack. You just remove it carefully and move on. Here are 5 things you need to know. First, check your neck once a month. Tilt your head back, swallow, and look in the mirror. If you see a lump, don't panic. Second, get an ultrasound. It's simple, painless, and tells you everything. Third, if the doctor says it's benign, leave it alone. No surgery, no medicine. Just monitor it once a year. Fourth, if it needs a biopsy, it's a tiny needle, not surgery. Takes 10 minutes. Fifth, even if it is cancer, 98% survival rate. You will be fine. Just follow your doctor's advice. Today you learned that thyroid nodules are very common, half of people over 50 have them. More than 90% are harmless. An ultrasound is the best way to check. Only 5 to 15% are cancerous, and even thyroid cancer has a 98% survival rate. Don't panic. Get checked. Stay calm. Tomorrow we finish Block 4 with the complete thyroid health checklist, everything you need to keep your thyroid running perfectly. This has been InfoVital. If you or someone you know has found a lump in their neck and is worried, share this video. It might save them from unnecessary panic. Hit like, subscribe, and share with someone who needs reassurance. See you tomorrow on day 21.